Here are the top stories for today, April 7, 2021. The government rolls out the emergency subsidy distribution for close to 23 million individuals affected by the enhanced community quarantine in the NCR Plus area. Not only in the Philippines, the country's vaccine czar assures all efforts are exerted to secure vaccines as supply woes hamper global inoculation campaigns. Two different things. President Rodrigo Duterte is optimistic that the apparent territorial row between the Philippines and China will not affect cooperation amidst the pandemic. And no Tokyo Games for North Korea as the communist state withdraws from the global sporting event over COVID-19 concerns. Good day, I am William Theo. Welcome to the PNA Newsroom. We begin with a sigh of relief for residents in the NCR Plus area. Close to 23 million residents in Metro Manila and the provinces of Bulacan, Cavite, and Laguna and Rizal are set to benefit from the emergency assistance which was officially rolled out today. Janice Cave has our top story.
From the coffers of the government, aid is now on the way to the hands of residents in areas under the enhanced community quarantine. In Parañaque City, Social Welfare and Development Secretary Rolando Bautista, Interior Undersecretary Jonathan Malaya, and local officials led the simple ceremony for the aid rollout in Barangay Vitales earlier today. Each beneficiary in the city will receive 1,000 pesos cash assistance, while a family will receive a maximum of 4,000 pesos. Parañaque City has received some 604 million pesos from the national government for the measure, which will benefit over 604,000 residents.
Tuloy-tuloy po rin po ang aming programa. Ito po yung assistance to individuals in crisis situation. Lahat po ng aming field offices nationwide and even ang aming opisina sa Batasan ay tuloy-tuloy po rin po ang pagtanggap ng mga kababayan natin na nangangailangan ng emergency assistance.
Aside from the aid from the national government, Parañaque and some LGUs are also coming up with their own amelioration and aid programs using their own savings.
May mga benepisyaryo na hindi naman kwalipikado. Kung sakali pong may makita kayo doon na benepisyaryo na sa tingin nyo ay di kwalipikado, o kaya naman, meron tayong kakababayan nagsasabi, ba't wala ako sa listahan? Makipag-ugnayan po kayo kaagad-agad sa inyong Grievance and Appeals Committee.
The aid distribution was also rolled out in Caloocan City. The city has received over 1.3 billion pesos in emergency assistance funds to aid over 1.3 million low-income residents. The list of beneficiaries are posted on the websites and social media pages of LGU in compliance with the guidelines for the measure. LGUs have 15 calendar days to release the emergency subsidy if given in cash and 30 days if given in kind. For the PNA Newsroom, I'm Janice Cave.
Malacanang maintains that there is not enough data yet that could prove the effectiveness of ivermectin in treating COVID-19. The drug was developed for certain animal species to treat internal and external parasites as well as prevention of heartworm disease. Presidential spokesperson Harry Roque advised advocates of ivermectin to wait for the approval of the Food and Drug Administration for its compassionate use before using it as a preventive medicine against COVID-19. The announcement comes after Anak Kalusugan Party List Representative Mike Defensor announced in a Facebook post that he will lead the free distribution of ivermectin in Quezon City.
Ang ivermectin naman po kasi, rehistrado siya pero hindi pang tao at for a different purpose, hindi pang COVID. Pero para sa COVID-19, wala pa po tayong datos na nagpapakita na talagang epektibo siya. Ang aking pakiusap, antayin na lang po natin kasi mabilisan naman po yan desisyon ng FDA na yan. No? Hindi naman po magtataga yan. At ito naman po ay para sa ating ating interest din. No? Dahil kinakailangan mapatunayan mabisa, epektibo at ligtas itong gamot nito para sa COVID-19.
Meanwhile, the Department of Justice or DOJ is giving Defensor the benefit of the doubt over his plans of giving away ivermectin. Secretary Menardo Guevara said he is sure that the lawmaker knows the FDA law very well and that he is very much aware of what is allowed and what is illegal under the law. Vaccine Czar Secretary Carlito Galvez Jr. explains that delays in the delivery of COVID-19 vaccines are due to global bottlenecks. He said this is being experienced not only in the Philippines but in other countries as well. According to a UNICEF report, all countries that secured AstraZeneca vaccines will be delivered this month as the pharmaceutical firm was not able to meet its target delivery last month. The SII has an agreement with AstraZeneca to provide the jabs for 64 lower-income economies alongside its commitments to the government of India. India, however, has a high demand for the vaccines, thus the delay. Meanwhile, full deployment of the newly arrived 1 million doses of Sinovac is ongoing nationwide. Another 1.5 million doses are arriving in the coming weeks, along with some 500,000 doses of Sputnik V from Russia's Gamaleya Research Institute. Meanwhile, the National Task Force Against COVID-19 said there is no need for mass testing or, by its definition, testing the 110 million Philippine population amid the rising coronavirus infections in the country. Testing czar Vince Dizon said taking the COVID-19 test should be guided by professionals or specific protocols set by experts. He added the government's approach for COVID-19 screening is based on the advice of health experts, which is risk-based and targeted testing. As countries around the world boost efforts to secure their own supply of COVID-19 jabs, the government is keen on establishing its own virology center. Under the Build Infrastructure program, the Virology Center is set to be constructed in New Clark City, Tarlac. The government has allocated 50 million pesos under the 2021 General Appropriations Act for the detailed engineering design of the Virology Institute, which aims to develop the country's own vaccine against diseases including COVID-19. Senator Christopher Lawrence Bongo supports the construction of the center as he stressed the need of the country to develop, produce, and manufacture its own vaccines. Defense Secretary Delfin Lorenzana is currently in isolation after he tested positive again for COVID-19. Lorenzana said the Department of National Defense will continue to operate with a skeleton workforce to ensure continuity of service with the prescribed health protocols strictly enforced. He said those who have been exposed to him have been informed and advised to isolate and get tested for COVID-19 as well. He also reminds everyone to cooperate and abide by the prescribed health protocols as the threat of the virus is as real, more so now due to the new variants. Still to come, off vaccines and islands, the palace says the sea row between Manila and Beijing has nothing to do with joint efforts to curb COVID-19. And a dangerous party, the tourism department is looking into an alleged COVID-19 super spreader event in Boracay. More on these when the PNA Newsroom continues.
Alamin kung paano ang tamang pagsusuot ng surgical mask. Una, hawakan ang mask sa strap at siguruhing natatakpan nito ang inyong bibig at ilong. Tandaan, ang may kulay na bahagi ng mask ang dapat nasa labas. Ito lamang ang tamang paraan ng pagsuot nito. Ihulma ang nose piece o maliit na metallic strip ayon sa hugis ng inyong ilong. Iwasan ang paghawak sa inyong ilong at bibig. Kung marumi na ang mask, hubarin ito gamit ang strap at itapon ito sa isang basurahan. Siguruhin ang maayos na paghuhugas ng kamay gamit ang sabon at tubig. Ang surgical mask ay dapat gamitin ng mga pasyenteng may sakit sa baga o mga taong mayroong ubo, sipon at lagnat, mga nag-aalaga sa mga may sakit, at mga healthcare at frontline workers. Maaari ring magsuot nito kung kayo ay pupunta sa matataong lugar. Basta't sama-sama at laging handa, kaya natin to! Isang paalala mula sa DOH, PCOO, KBP at ng himpilang ito.
President Rodrigo Duterte is optimistic that the current conflict between the Philippines and China over the presence of Chinese vessels in Julian Felipe Reef will not hinder the cooperation of both countries on the fight against COVID-19. Presidential spokesperson Harry Roque said Duterte's stance is to resolve the issues concerning Julian Felipe Reef through diplomatic channels and through peaceful means.
This is an official statement from the President. No? We will continue to resolve the issues on Julian Felipe through diplomatic channels and through peaceful means. Whatever differences we have with China will not define our bilateral relations. It will not be an obstacle to the overall positive trajectory of our bilateral friendly relations and our deepening cooperation in pandemic response, including vaccine cooperation and in post-pandemic economic recovery.
Vaccine Czar Secretary Carlito Galvez Jr. also echoed Duterte's position, saying the controversy surrounding Julian Felipe Reef is a separate issue.
Ang ano po natin na separate po yung issue po na yan. Ang ano po natin ngayon ay the Chinese government is joining us in fighting against COVID-19. It's a fight for humanity at saka ano po natin diyan is talagang naman itong issue ng ng West Philippine Sea ito po yan.
More than 5,000 ECQ violators in Manila were apprehended since last week as the Philippine National Police intensifies its operations. Manila Police District Director Brigadier General Leo Francisco said violators have already decreased from 1,000 to only 400 per day. Among those who were apprehended were unauthorized persons outside their residence. Violations include drinking in public, going out half naked, urinating or smoking in public places, anti-noise or the use of videoke outside prescribed hours, and obstruction of justice. Francisco asked the public's cooperation to defeat the coronavirus disease pandemic by following minimum health and safety standards and other protocols mandated by the Interagency Task Force. He also urged citizens to text their complaints to 2920 and to specify the streets or the address where there are observed violations. The local government of Malay has launched an investigation on a party that allegedly caused the recent spike in COVID-19 cases in Boracay. Barangay Balabag was placed under enhanced community quarantine, while Zones 1 and 7 of Barangay Manok-Manok were declared under surgical lockdown until April 14. For its part, the Department of Tourism vowed to closely coordinate with local officials and tourism establishments to ensure a stricter implementation of protocols. A tourist from Luzon who visited a friend in Boracay on March 10 was identified as the source of the virus. The tourist left Boracay on March 13 and was tested positive for COVID-19 on March 16. However, the visitor failed to inform the close contact in Boracay that he was infected. The tourist had attended a party on the island and infected several others. The contact eventually manifested symptoms and was brought to the hospital on March 23. The Department of Health, or DOH, is resolving a technical issue with the case collection systems that resulted in lower reporting of deaths from COVID-19 counts over the past week. In a statement, the DOH said the glitch caused incomplete fatality numbers and encoded data. As a result, 341 deaths prior to April 2021 went unreported. It said the number of deaths reported on April 6, which is at 382, already includes the said deaths not reported in previous counts. Despite the additional cases, the cumulative case fatality rate for the Philippines remains low at 1.7%, and the average deaths per day for March is at 28. This is lower than the 27 average deaths per day seen in February and lower than the 32 average deaths per day in January. Meanwhile, the DOH also issued guidelines on the use and administration of saliva-based RT-PCR tests. It said only licensed laboratories certified by the Research Institute for Tropical Medicine, or RITM, are allowed to perform saliva-based testing. Personnel who are duly trained by a licensed laboratory can perform saliva specimen collection. Test kits must pass the performance validation conducted by the RITM or other recognized laboratories and have a special certification from the Food and Drug Administration or the FDA. Only trained saliva specimen collectors should administer the test, and only medical doctors should interpret the results of these tests. The DOH said that saliva tests should only be done on certain valid conditions. And in our business news, the surge in COVID-19 infections is expected to result to below target growth for the Philippine economy this year. Finance Secretary Carlos Dominguez III expects the economy to lose at least 0.5% of the gross domestic product due to the latest lockdown. Dominguez noted that the surge, which is also happening in other places such as Brazil, Canada, France, and Turkey, is certainly not good for the economy. Economic managers have set a growth target as measured by GDP of between 6.5 and 7.5% this year. Meanwhile, Dominguez said the government continues to have fiscal leeway despite the financing for COVID-19 related programs. Last year, the government extended 5,000 to 8,000 pesos in cash aid to around 18 million low-income households and to sectors greatly affected by the quarantine measures. This year, the government is using the 23 billion peso untapped allocation under the Bayanihan II law as subsidy for around 80% of the population in the NCR+. Up next, 5 more NPA rebels surrender to authorities in Sultan Kudarat, and it's a no for North Korea as it withdraws from the Tokyo Olympics. The PNA Newsroom returns after these reminders.
Alamin ang tamang paraan ng pag-ubo upang mapigilan ang paglaganap ng Coronavirus Disease 2019. Ugaliing magdala ng panyo o tissue. Kung uubo o babahing, takpan ang buong ilong at bibig gamit ang panyo o tissue. Kung walang dalang panyo o tissue, maaaring gamitin ang braso na pantakip. Kung nakararamdam na kailangan umubo o bumahing, agad na dumistansya sa mga tao sa paligid. Huwag dumura kung saan-saan, gumamit ng tissue at itapon sa basurahan. Ugaliin ang paghuhugas ng kamay at paggamit ng alcohol o hand sanitizer upang mamatay ang mikrobyo. Basta't sama-sama at laging handa, kaya natin to! Isang paalala mula sa DOH, PCOO, KBP at ng himpilang ito.
You're still watching the PNA Newsroom. Cagayan de Oro City is set to launch what it called as its local version of the Research Institute for Tropical Medicine as it prepares to combat COVID-19 and other infectious diseases. This and other news in today's Provincial Roundup from Marita Mowahe.
A medical facility in San Simon, Cagayan de Oro City is set to be turned over as an infectious disease center to the state-run Northern Mindanao Medical Center on Thursday, April 8. Mayor Oscar Moreno said he hopes the Northern Mindanao Medical Center Cagayan de Oro City Center for Emerging and Re-Emerging Infectious Diseases would cater not only to Region 10 but would also be Mindanao's own research institute for tropical medicine. While the facility was created to address the COVID-19 pandemic, Moreno said its long-term function would be as an infectious disease hub for Mindanao, similar to Manila's RITM. The center is equipped with 5 wards that can house at least 75 patients and a laboratory which can test specimens for traces of COVID-19, among others. In Ilocos Norte, the municipal government of Vintar, known for its zipline and bike line adventures, is temporarily keeping its ecotourism attractions exclusive for residents to curb the spread of COVID-19. Mayor Larissa Foronda said the Umok Nisiwawer Ecotourism Nature Park and all other attractions will be closed to guests from outside. This as contact tracing is ongoing after 2 new cases were confirmed in barangays San Ramon and Cabangaran. Even if tourism spots are open for residents, picnic cottages for rent along the Bislac River will be strictly regulated to 10 persons per cottage. Meanwhile, the Department of Education Division of Antique canceled its module retrieval and distribution from April 5 to 19 due to the rise of COVID-19 cases. DepEd Superintendent Felisa Beryong also issued Memorandum Order 128 on Monday, calling for the cancellation, citing Antique being under courtesy lockdown from April 5 to 19. Teachers were directed to adopt a work-from-home scheme during the 2-week courtesy lockdown. Beryong added that she also received a letter from Governor Rodora Cadiao requesting the use of their school as quarantine facilities if needed. For the PNA Newsroom, I'm Marita Muaje.
The military seized the hold of the communist terrorist group New People's Army in Sultan Kudarat, weakening with the surrender of 5 more of its members, including a ranking leader, on Tuesday. Lieutenant Colonel Romel Valencia, commanding officer of the Army's 7th Infantry Battalion, identified the 5 as members of the NPA Sub-Regional Committee Daguma Far South Mindanao region. The former rebels yielded at the 7IB headquarters in Barangay Calawag 2, Isulan. Earlier this week, 9 other rebels surrendered to the military 603rd Infantry Brigade in Calamansig Town. Major General Juby Max Uy, commander of the Army's 6th Infantry Division, said a total of 37 NPA combatants have surrendered in central Mindanao since January 1. We urged other NPA members still in the mountains to surrender and live normal lives again with their families. In sports, North Korea on Tuesday withdrew from the Tokyo 2020 Olympic Games because of coronavirus fears, making it the first country to formally exit the event. The North Korean Sports Ministry announced on its website that the decision was taken during a North Korean Olympic Committee session in Pyongyang last month. In March 2018, North Korean leader Kim Jong-un said North Korea would definitely participate in the Tokyo Olympics and the 2022 Beijing Winter Games. South Korea's Unification Ministry expressed regret over the decision, saying that it hoped the Olympics could be a chance to promote reconciliation and cooperation, as well as peace in the Korean Peninsula. The local government unit of Naga City and the Central Bicol State University of Agriculture, or CBSUA, will be working together in developing a technology to help achieve zero waste management in the city. The method will be implemented at the sanitary landfill in Barangay San Isidro, which is being run through the Solid Waste Management Office, or SWMO. CBSUA President Alberto Naperi said they will introduce in the project the principle of circular economy, a system aimed at eliminating waste through continual reuse, sharing, repair, refurbishment, remanufacturing, and recycling. Mayor Nelson Legacion, meanwhile, said the project will further improve the LGU's approaches to orderly and systematic disposal of garbage. He said aside from the livelihood opportunity it will create for individuals engaged in collecting, sorting, and cleaning plastic waste and other resources. Here's another look at today's biggest stories. The government rolls out the emergency subsidy distribution for close to 23 million individuals affected by the enhanced community quarantine in the NCR Plus area. Not only in the Philippines, the country's vaccine czar assures all efforts are exerted to secure vaccines as supply woes hamper global inoculation campaigns. Two different things, President Rodrigo Duterte is optimistic that the apparent territorial row between the Philippines and China will not affect cooperation amidst the pandemic. And no Tokyo Games for North Korea as the communist state withdraws from the global sporting event over COVID-19 concerns. Thank you for watching another episode of the PNA Newsroom. To check more news content, visit our webpage or head onto the Philippine News Agency's Facebook and Twitter accounts. For more stories about the government and how it serves Filipinos, look for these hashtags in all of our social media platforms and websites. We are shown on the pages of the PCOO and its attached agencies. Also, watch us on television on PTV4 and IBC 13. And that's your daily dose of the biggest stories that you need to know from the PNA Newsroom. We tell stories that inspire change. I am William Theo. Good day to all.